Hello, I'm Mary Miller of the Breastfeeding Support Center of Western New York, and this is our parent guide to tongue, lip, and cheek ties. Tethered oral tissues, or TOTs as they can be called, are not a new thing. In fact, they've been represented in the literature for close to 2,000 years. So while some physicians will say that diagnosing TOTs is a fad, this is certainly not backed by evidence. TOTs can include lip ties, tongue ties, and buccal ties, which are more commonly understood to be cheek ties. Essentially, a tie is when the connective tissue of the tongue, lip, or cheek is so short or thick that it inhibits proper functional movement of the tongue, lip, or cheek. It's not about the appearance of the tie so much as it is about the function of that body part. There can be many different presentations of ties, but the most commonly seen types are lip ties, tongue ties, and cheek ties. In this image, you can see a lip tie where this connective tissue is wrapped around this baby's gums so tightly that it's actually causing notching in the gum. This tissue will restrict the lips from moving in the way that they need to and can result in a baby holding on too tight to the mother's nipple while they're nursing or leaking milk out the sides of the mouth while breastfeeding or bottle feeding, and can inhibit the mouth from just closing comfortably at rest. A tongue tie, which you can also see in this picture, is when there's connective tissue that connects the tongue to the floor of the mouth in a way that is so tight it doesn't allow for the tongue to go up into the roof of the mouth. Some babies with ties are capable of sticking their tongue out over their lower gums or even out past their lower lips. So some physicians will tell you if your baby is capable of doing this, then they're not tied. However, the evidence shows us that in order to suck and swallow effectively, the middle of the tongue needs to be able to elevate to the roof of the mouth. So it's not outward movement we're looking for, it's upward movement. And babies with tongue ties will not be able to move their tongue upward to the roof of the mouth. Buccal ties are a little less common, but they do still happen. And buccal ties are diagnosed when there is connective tissue between the cheek and the gums that inhibit movement of the cheek. And proper cheek movement is very important to the ability to suck correctly. While this list of red flag symptoms is certainly not exhausted, it is commonly accepted by most medical professionals who are tie savvy to be very common symptoms for folks in the situation. For the infant, whether they are breastfed or bottle fed, they may be diagnosed with reflux and may possibly be put onto medication to manage the reflux. They may experience colic symptoms where they're extremely fussy. They may be very gassy and have a distended belly, lots of farts, lots of burps, or on the flip side, may not burp very easily at all and may have some very painful gas. They may, depending on which side of the spectrum the mother's milk supply is on and the way her milk comes out, the baby may have either very slow or very excessive weight gain. It could be either end of that spectrum. They may leak milk at the sides of their mouth while they're eating because they can't close their mouth properly and make a seal around whatever it is that they're drinking from. They may have blisters on their lips. These blisters are very commonly called nursing blisters, and many parents are told that they're normal. And while it is true that they're very common, that doesn't mean that they are optimal and that they are biologically normal. They are a red flag that indicates that your baby is not sucking correctly. And if they're not sucking correctly, chances are they're not swallowing correctly either. They may also have open mouth breathing or an open mouth posture while they're at rest, which is its own set of has its own set of red flags for down the line as well, but open mouth breathing is always something of concern for any infant, and they should be checked out right away by somebody who knows how to do a full body assessment. The breastfeeding parent may experience nipple or breast pain. They may have cracked or bleeding nipples or misshapen nipples. Sometimes they can look like a new tube of lipstick when the baby comes off after nursing. They may have either recurring clogged ducts or mastitis that keeps coming back, or every few months they may get another case of mastitis again. And as well, depending on which side of the spectrum they're on, they may either have a secondary low milk supply if their baby's unable to nurse effectively, or they may have the belief that their milk supply is too high or that their letdown is way too rapid if the baby will often, pull off and choke and sputter while nursing on the breast. If you ever notice clicking on the breast or the bottle, it's a very loud, noticeable sound. This is always a problem. This is always a red flag. It doesn't always necessarily mean that there is a tongue tie present or some other type of tie present, but it does mean that there's a problem that needs to be worked out. Those types of clicks will end up causing some gas problems and could potentially contribute to aerophagia-induced reflux, which is a type of reflux that's very commonly diagnosed and medicated, although it's very easily preventable and treatable through non-medicative ways. The baby may chomp on the breast or gum the breast or bottle in order to stop the flow, perhaps. This is definitely something that a baby can do if they can't handle that flow. They may slip on or off the breast or bottle, but especially the breast. These are the babies where mom has to hold on to her breast while she's feeding the baby, because otherwise the nipple will just slip right out of the baby's mouth. Now, especially if a baby is being supplemented with bottles, they are very likely to fall asleep while they're feeding at the breast very, very quickly. Sometimes within moments after they latch on, they might fall asleep, although falling asleep at the breast is very, very common in the first week or so of breastfeeding. So what do you do if you think your child might have a tie? Good news, you're already on the right path by trusting your instincts that something's not right. The first step would be to seek out a tie-savvy IBCLC for an oral assessment. Here at the Breastfeeding Support Center, we conduct a thorough assessment of your baby from head to toe, including lip and tongue mobility. And we will work with you to come up with the proper plan and put together the best interdisciplinary team for your individual situation. There are so many misconceptions online and among physicians about the best way to treat tethered oral tissues. We're here to help support you with the latest high-quality evidence so that you can make the best choice for you and your family. To schedule your infant's oral function assessment, please send your full name and email address. You can text us to 716-780-2662, or if you would rather, you can fill out the contact form on our website at www.breastfeedingsupportcenterwny.com. We are looking forward to meeting and treating you and your family.